been 2 years since the first case of Covid-19 was discovered in South Africa, and our daily lives since then changed forever. The country has seen over 3.5 million cases, and we've lost just over 99,517 people to the virus. For more on this, I'm now joined by the Department of Health's Deputy Director General, Dr. Nicholas Crisp. Dr. Crisp, thank you so much for your time and for joining us this Saturday afternoon. So much more has happened over the past 2 years since the first case of Covid-19 was detected in the country. In your perspective, what would you say is the most significant lesson we now know about COVID?
Wow, good afternoon and good afternoon to your viewers. We've learned so many lessons. What a roller coaster ride this has been. But I guess what stands out for me is that our health is in our hands, and if we don't collectively work together to improve our health, then everybody suffers. So we have to recognize that every person's health is my health, and I'm dependent on them being healthy.
Now, taking stock of how the entire country has since then dealt with COVID-19, since we saw the first case being detected, to experiencing multiple waves of the virus and seeing really the almost collapse of our health systems, how would you say government has then dealt with this pandemic?
Well, first of all, I want to say it's not just government. So it's been a fantastic collaboration between everybody. The government and the private sector, a number of government departments have joined in the fray, and many businesses and industries and mines and so forth have come to the party as well. Trade unions, religious groups and so forth. So from our perspective, we are thrilled that we've been able to play that leadership role. At no stage did we think that the health system would collapse. Neither the public nor the private sector was going to collapse. They have been severely strained, and health workers have really taken a battering during this time. Initially with deaths of their colleagues and with not being able to vaccinate. It was extremely traumatic for everybody, and many healthcare workers have suffered a lot of mental stress. But it never collapsed, and that is encouraging. And we were able to mount a very, very significant, the biggest public health intervention that has ever been experienced in the country. Very well collectively, and that augurs well for the future for all of us.
Since then, South Africa was one of the countries who experienced, some of the harshest lockdown restrictions in as far as taking some of those non-pharmaceutical measures to prevent the further spreading of this deadly virus. And I want us to speak on that now, since calls of the removal of the state of disaster to be removed as cases are declining, reflecting on those lockdown restrictions. There seems to be many sentiments, varying sentiments there is, that some people saying that it was the expense of many South Africans and the economy, and that. Let's just speak as just how important that period was for the country.
Yeah, thanks. Look, I think it's always easier to see things in retrospective than prospectively know what's going on when you don't have data available. But let's be clear, South Africa had nowhere near the harshest lockdown conditions anywhere in the world. There are many countries in the world who have way more lockdown conditions than we have even now, even on the African continent and elsewhere. The countries that are lifting those restrictions, and we are headed that way, have vaccination coverages in the 90s. We know that France and Canada and Norway and so forth are all over 90% vaccinated, and there are countries that are vaccinated over 70% that are maintaining some of their lockdown conditions. So these two matters are tied to one another. We may well have reports of fairly good immunity from wild virus infection, but we do know that if you're not vaccinated and you haven't boosted your immunity through that means, you don't build good cellular immunity, which is the long-lasting immunity that we need. So we should be very cautious to try and emulate France or the UK that are sitting with double our vaccination coverage and think that we're going to get away with, lightly when there's another wave. There will be another wave. We just believe and hope sincerely that it will not be as aggressive as what we've had up till now. But that's the nature of the beast at the moment, and this virus continues to mutate.
Now, speaking with regards to, future waves of the COVID-19 pandemic that we are now, anticipating, and I just want us to speak to the calls that are now since rising for the removal of the State of Disaster Act in this place. Do you feel that this is indeed the right time to be removing these restrictions?
So I think that we need to appreciate that we basically have most of the restrictions are already lifted. I know it's inconvenient to wear a mask. None of us likes to wear a mask all the time. And we would like to get back to work and do things the way we did them before. So when we are able to be certain that we can protect ourselves, then we don't need the state of disaster. And our president, minister, other ministers have all spoken that nobody wants to maintain the state of disaster any longer than it needs to be. And we've all been under pressure as government departments to make sure that the necessary regulations are in place to do all the kinds of things that we may need to do if things do take a turn for the worst. That is not only health regulations, but regulations that will allow social development to do what they need to do with grants and to let the business sector be able to do what they need to do with supplementary budgets and giving concessions to various workplaces. We need to make sure that as a nation, we are not trapped in our own enthusiasm to get rid of the state of disaster. What we can do is to reduce and reduce and reduce until that point, as long as there's not another massive wave that catches us.
I suppose then when we're taking stock of what South Africa has since learned from the COVID-19 pandemic and in as far as dealing with other future health pandemics, and not to call it at this very moment, but then what would you say has been the greatest lesson in as far as, the support given to our scientists, the health departments and the health, sector as a whole, and looking at South Africa's capabilities in as far as, looking at vaccination, production and those certain sectors, what have we really learned that we can further then move in supporting, the health sector?
Yeah, so I think the first thing is that the health sector does not function on its own. We require environmental health, social development, the education authorities, and a whole range of other government departments to play this game with us, and most of them have been very open and work closely with us. I mean, higher education is a very strong partner at the moment, for instance. So that's the one thing. Government, we need a whole of government approach. Secondly, we need a whole of society approach. Everyone keeps asking me, what's the health department doing about A and B and C? We're a relatively small department. Nationally, we're only 1,100 people. And across the whole country, with all the provinces, the public sector is only 330,000 staff members. Then we have a sizable private sector. And what we have learned is that if we work together, and we have done remarkably well to work together during this period, we can achieve a lot more. The third thing we need to know is that surveillance is everything. We were not prepared. We did not have integrated systems. We have a hugely fragmented health system with many different players. And as a result of that, we did not have one surveillance system that was able to warn us and help us to prepare and take decisions. We now have such a surveillance system in place, and the private and the public sector all contribute to that one surveillance system. It's not as strong as it needs to be, but it's vastly better than it was. So we need to consolidate that and invest in that. And then we need the public to trust government. And right now, the public does not trust the establishment, that's the older people amongst the community, and do not trust government. We need to do things in government and as the elders within society that the rest of the people in our communities trust us. Because if you can't trust the facts and you can't trust the evidence that is coming out of the global and the local science community, then we are really in trouble. So we will need to invest, and we are grateful for Department of Science Innovations investments, Health Department's investments, donor partners, the World Health Organization, and a number of private companies that have invested very strongly in these capabilities. And we've seen in the recent days with the visit of Dr. Tedros Ghebreyesus from the World Health Organization, the tremendous effort that the global community is putting into supporting South Africa to be ready, to play a role in Africa, not just South Africa, and be ready with our biologicals so that we can fight against these viruses.
And Dr. Crisp, as a parting question, you've just mentioned the issue of trust. And when we're looking at the point that we are now in as a country, till, our next future health pandemic or crisis, how do we then, government, and private sector, then sort of bridge in that gap and do the work in the meantime before we are yet to see another disaster to help build that trust?
Well, you've just played directly into my hands because I'm the person responsible for leading the National Health Insurance. So I'll use the opportunity to bat for it. People need to know the facts and understand what we are trying to achieve with the National Health Insurance. And it's about making sure we are spread what we have equitably and we are all able to get proper health care. The details of that will unfold. Parliamentary hearings in the National Assembly through the Portfolio Committee have concluded. There will be some responses now to that. I'm sure there will be some amendments to the legislation and further debate. But one thing is for certain, we need a coherent, single national health service, and we need to make sure that we pay for that service upfront so that none of us is caught in a dire financial position when it's our turn to be ill. So I think that's the flavor of the day, and we'll be talking to all the role players in both the public and private health sectors, but also in the businesses that support us in the pharmaco sector and others.
Well, Dr. Crisp, thank you so much for your time and for speaking with us this afternoon. Have a lovely Saturday further.